hospital was able to maintain critical hospital operations throughout the storm and was able to bring community-based clinics back into operations within weeks. Additionally, we were in a position to offer assistance to other healthcare systems more severely impacted by the hurricane. These efforts did not come without certain limitations and challenges. Immediately following the storm, VA outpatient clinics relied on generator power and limited communication capabilities, including data resources. Roughly 23,000 appointments were canceled as a direct result of the hurricane. Staff have reached out to all veterans whose appointments were canceled. More than 21,000 appointments were rescheduled, with the remainder not indicating the need for an appointment. We are currently focused on preparing for this year's hurricane season. Efforts underway to prepare in advance include outreach to vulnerable and high-risk veteran populations, building on established relationships with community partners, updating lease agreements to ensure a timely response after a natural disaster, and exploring more reliable voice and data communication strategies. Most importantly, there are $27 million in high-risk infrastructure improvements that must be completed before the beginning of the upcoming hurricane season. We remain committed to providing exceptional healthcare and emergency preparedness, pursuing this objective in close collaboration with our federal partners, leading national organizations, local government agencies, veteran service organizations, and other nonprofits. We welcome the opportunity to expand current efforts as well as establish new agreements that will benefit veterans throughout Puerto Rico and the U.S. Virgin Islands. The VA remains committed to open dialogue regarding joint efforts and enthusiastically encourages their development. While VA excelled during times of crisis, there is still action required to ensure the needs of veterans in Puerto Rico and the U.S. Virgin Islands are consistently met. Sustaining the momentum and preserving the gains made so far requires continued attention and investment of financial resources. Failure to provide such resources will severely jeopardize our ability to sustain our progress and will put at risk thousands of veterans and their families in the future. It is critical that we continue to move forward after the hurricanes and continually improve the system of care that is provided by VA Caribbean Healthcare System. Mr. Chairman, this concludes my testimony. My colleague and I are prepared to answer questions.
Well, thank you all very much for your testimonies. We will now take time for questions, and I will yield myself 5 minutes for questions. And I would like to start with you, Dr. Rodriguez, if I may.
Sure.
You've talked a little bit about academic relationships between healthcare systems, and also, I know yesterday we also discussed opportunities for military medical personnel to engage, as we do, say, in San Antonio, where the San Antonio Medical Center provides for the community, trauma and everything. And then there's programs such as the Air Force has, which is the C-STARS program, Centers for Sustainment of Trauma and Readiness Skills, and they embed military personnel into private level 1 trauma centers to engage, to provide care and to train. And so, in your view, what are some of the opportunities for military medical personnel, active and reserve, to train, provide care, augment care for veterans and residents of Puerto Rico?
As you, thank you, Mr. Chairman. As we discussed yesterday, the most typical example of that is Brooke Army Medical Center, where they is open for treatment of trauma patients from the civilian part. By a chance, I was a staff neurosurgeon there on 2005 when I was deployed there. So I know I work very closely with that type of endeavor. In Puerto Rico, we have other VA centers, as is well known by you. Academic centers help the VA in order to give services. They share faculty and also improve the health care of the veteran population. We used to have that close relationship many years ago. I remember when I was in my residency by that time that we rotate and have a formal rotation at the VA, and the faculty of neurosurgery share credentialing between both the academic center and the VA. As well, faculty from the Veteran Administration Hospital also serve as teaching there in the civilian sector. So I think that that is a thing that we have to explore, to seek again that type of relationship between the academic and the VA for the well-being of the veteran population. I think that that will be fantastic to return that policy again, and to be sure that we can work as good neighbors.
Thank you. Dr. Lopez, do you have any comment on that? And is there any relationship right now with Fort Buchanan and the VA from the healthcare standpoint?
Yes, sir. There is already an existing relationship between the DOD and the VA, and I will yield to Dr. Sanchez, who can talk to the specifics of that relationship.
Thank you.
Yeah, good morning, Dr. Wenstrod and Dr. Rowe and Congresswoman Gonzalez-Colon. Thank you very much for the opportunity. For me, it's a privilege to be here. And thank you very much for yesterday's visit to our facility on behalf of all the veterans and as well as the workforce that I represent. It was an honor having you there, and thank you for the great work that you have been doing. The VA Caribbean healthcare system for many, many years has been doing a lot of affiliations and collaboration with the Department of Defense, mainly with the Buchanan base clinic that we have there. We share some clinics, for example, for phlebotomy labs there. There is a lot of patients that go there because we had some parking issues in the past, more than now. And then we have been in that kind of collaboration. And actually, our facility trained part of the DOD mortuary personnel in different partnership of education as well. It is limited, and I welcome all of the possibilities to continue expanding services. Three weeks ago, I received the visit of the Commander Lozano, who is the Buchanan Clinic Director, and he told me that they are in conversation after the hurricane to construct probably a new clinic in Buchanan, and he wants us to be part of that planning phase since the beginning, and I think that that is a great collaboration. And everything that I am listening now, I think that we need to take advantage of that momentum and work all collaboratively. If we can expand or decompress the facility that we have, expanding services for our veterans, it will be a win-to-win relation for all the veterans. That is our purpose for that.
So Buchanan's providing some ancillary services right now. Are they seeing patients as well, veteran patients as well?
Yes, they receive for phlebotomy, for laboratories, and we collaborate with our chief of pathology, help them to maintain the accreditation of their labs. And while the reservists, that is another agreement that we have, while the reservists are active, we receive military active for any emergency care in our facilities as well. That is part of our agreements that we have with the DOD as well. But as I said, there is room for continue enhancing all of that. In the past, we had been in conversation to have co-located clinics, for example, for the compensation and pension exams. We do those in our facility. Last year, we were in collaboration in the planning phase in using some buildings that they have available and had co-located clinics to assure that the soldier in the transition going out of the military and then becoming part of the VA system and also with the Veteran Benefit Administration. One part is done in the Buchanan base and another part is done by us in the hospital. So we were in those planning of having a co-location. But now with the Commander Lozano thinking, and he has been working with the Department of Defense, that the clinic could be remodeled and a new clinic. They probably can have more space, and then we can work other initiatives at the same time.
Thank you. My time has expired. Dr. Rowe, you're now recognized.
Thank you, Mr. Chairman. And first of all, I want to just give a shout out to all the veterans who are here and the Puerto Rican people for undergoing incredible hardships during the past several months after not one but two major hurricanes that hit this island and really devastated much of your infrastructure. So your patience, Job would be proud of you, I can tell you, in the Bible. Christine Hill is the staff director for the subcommittee on health, but she also is a former B-1 bomber pilot. Me being an infantryman, I stayed a little closer to the ground myself. A couple of things that I wanted to go over just quickly, Mr. Chairman, is that I heard several things, and I will just mention these. Dr. Ramos brought these out. We heard this in our VSO roundtable this morning, and we heard it yesterday, both in the public health hospital and in the VA hospital, chronic understaffing, and both in mental health and in others. So hiring takes too long. Dr. Ramos, you're absolutely right. VA is glacial in hiring physicians. We see it stateside where you get a gastroenterologist and it may take 6 months to hire them. In private practice, it would take me 2 days to hire that person. The other thing that was brought up about paying in a timely fashion, Medicare pays about 95% of its claims in a month. The VA is about 60%. The Secretary is very well aware of that. That's one of the problems in the choice program that needs to be worked out. So we hear you loud and clear. I wanted to share that with you. I heard something this morning that I'd like Dr. LaPaz get some clarification on. In your written testimony, you stated that the VA at the Caribbean Health Center was able to reach 100% of over 3,000 veterans identified as being members of a vulnerable population, which included veterans experiencing homelessness, those requiring hemodialysis, those dependent on ventilators, those at high risk for suicide, and those with severe mental health issues. Assisted by FEMA, VA staff used ground, air, sea transportation methods to meet with each veteran to confirm his or her well-being. What we heard this morning, though, in the roundtable is that as many as 90% of the people that the VSOs met, and I won't mention which one, there was no visit from the VA. And so how do you reconcile those? One say that they didn't get out to see the veterans, and you say that you got out to all of them. So how do you reconcile that?
So we identified the high vulnerability, the highly vulnerable veterans, and those veterans are the homeless veterans, the ones that are requiring chronic care, the ones that are actually enrolled in our home-based primary care, the ones that are involved in the MECOM program, for example, which is a mental health intensive case management program. So in that category of veterans, we, in all of the situations as part of our hurricane hardening, we reach out to them to make sure that even before the hurricane hits, that they are actually prepared for those situations. So it is not reaching out to all of the veterans enrolled. It is reaching out to all the veterans that are belonging to that high-risk population.
Well, do you meet with the VSOs, or not you particularly, because you're the director, but do the local VA, maybe Dr. Sanchez, better for you, but do you reach out to these folks to reconcile these differences? Because I think that's extremely important, because their perception of what happened and your perception of what happened are two different things.
Yeah, thank you for the opportunity to clarify that. And definitely, we work very close with the Veteran Service Organization leaders, and they were most of them were part of this effort of identifying a lot of veterans that needed our intervention because they needed healthcare issues, and a lot of them, thanks to the great job that they were doing, outreaching. Remember, this was a complete catastrophe in Puerto Rico. All the veterans and all the citizens had major issues, problem with communication. So definitely is part of our process with the VSOs to clarify what was the total population that we reach out. And there was a lot of other needs in veteran that not necessarily was healthcare related needs. And then is when our social work coordinator with the local agency to help them, let's say housing, food, clothing, other kind of thing that in our scope, as a hospital, we cannot help them, but we help them to coordinate with the other agencies through FEMA and all of that. But definitely it's something that we can clarify more to them. We have been tracking, and we were tracking all those more than 3,000 special or vulnerable patients because of their condition. Their life were critical. Patient on ventilator, we needed to assure that they had a generator in their house. If not, and we brought several of them to the facility because they didn't have a good generator. Patient in anticoagulation medication, we needed to assure to have, but it took time because the roads and the streets were completely impacted. There was a lot of problem to reach out them. And that's why the VSO went to the street and helped us. I received as a commander in the incident command post, they were constantly referring and we were reaching out then. But definitely we will accept your recommendation, Dr. Roth, of talking. Actually, tomorrow we have already planned what we call a VSO strategic planning, because prior to the hurricane, the VSO created what they call a coalition of VSOs in Puerto Rico. They met with me, and we were planning this strategic planning. And unfortunately, because of the hurricane, it was, delayed, but it is going to happen tomorrow in my facility. In order to create a strategic planning to address all and prioritize all of those areas that they have been bringing, because a lot of things that we have been doing through the years has been thanks that they have brought out to us, and they have been advocated together with the federal government, with the organization, moving on. But there is other areas that we need to continue working all together.
Well,
so I will touch base about that topic.
I would say that they are a tremendous resource for
yes,
you.
Definitely, and I'm
that
very proud of them.
They can be very helpful. And I would like to ask, and this, my time's expired, I'm going to yield back, but a question that maybe we can get it from Mr. Ratchford or Dr. La Paz in writing is, what lessons have been learned with this particular Hurricane, the two, and then sort of an after-action report, and then how are you better preparing, since unfortunately the hurricane season's just a couple of months away? I yield back.
Thank you. Ms. Gonzalez-Colon, you're now recognized.
Thank you, Mr. Chairman. First of all, I want to recognize some people in the audience today, like General Isabelo Rivera, our National Guard General from Puerto Rico. Thank you for coming here. And I want to thank Chairwoman from the Veteran Affairs Committee in the House, Lourdes Ramos, and Chairman of the Veterans Affairs Committee in the Senate side, Jose Luis Dalmau, Jose Aponte, former Speaker of the House and Chair of the Federal Affairs Committee in the House, is also with us today and with us during the roundtable, and Representative Felix Lasalle from the western part of the island. Thank you for being here today. Having said that, we got a lot of questions. Yesterday we went to the VA facilities and we account of the situation regarding the clinics on the VA system. One of them we're going to visit today in the afternoon, which is the clinic from Arecibo, where many people are receiving their services in tents. So same thing happened with the situation in Vieques. Mr. Lapuz, my first question will be, are we using the mobile units to serve those areas or not?
Yes, sir. Yes, ma'am. We are using the, right now, what we have there is in Arecibo, we have a Western shelter. Mm-hmm. So we have almost a complete clinic, which is actually house in the Western shelter, so that you will see that shortly. However, we have a contracting. It's already in contracting, trying to identify a new location for the Arecibo clinic so we can also begin construction of the new clinic. So we expect that is going to be before the end of the month. We'll have a clarity regarding the location that has been identified through the bid process.
Can you answer directly my question in terms of how many mobile units are we using in Puerto Rico?
Oh, I'm sorry. I'll defer to Dr. Sanchez regarding the number
Thank
of
you.
mobile units.
Yes. Immediately after we started work with the emergency, we received from the state 2 mobile units, one from Tampa and one from Orlando. In the
Are they
first
are
3
they
to
in
4.
use right now?
They are being used,
Where?
one in Arecibo as part of the compound that we have there with the Western Shelter, specifically for the mental health clinic. And the other one is being used in Vieques. Vieques, we were doing home visit until like 3 weeks ago when we were able, working with the Puerto Rico Health Department and
To move
FEMA,
that mobile
and we
unit.
moved on the mobile unit, and now we have it there with all the utilities.
Okay, how many doctors and nurses are those mobile units are using?
Well, in Arecibo, we are using all the staff of the clinic. We have, I don't
So besides, my question will be, sorry about that. My question will be, besides the mobile unit and the tents that are, or the clinic that you're using, do you receive with the mobile unit more human resources to attend the patients or not? Or you're just using the physical facility?
Yes, we are using the same staff from Arecibo. All of them are in the compound, and the same staff that are 3 staff is a physician, a clerk, and a nurse. In Vieques, they are the same that they were doing home visits. Now they are located in just one of the mobile units.
The VA and the Congress just approved $11.1 million to mobile units and medical service, including transportation, for the areas impacted by the hurricane. So I expect part of that money is going to be directly to those areas in Vieques and the areas that are being affected directly by the hurricane here in Puerto Rico. And I would love to have a report on the issues of those monies to the island, if the chairman of the committee allowed me to request that information. The second will be in terms of how many veterans have been able to be treated in those 2 facilities, in those 2 mobile units. Do you got the count of those numbers or not?
Well, yes, on daily basis, and Dr. Rode and Dr. Wenstrup yesterday were able to see the tracking that we are following in the Incident Command Post Center. We track on daily basis all the veterans that we are seeing.
How many?
I don't have it from my mind,
perfect.
but
Can
we
you
can
provide
get
it
to
later
you.
on?
Definitely.
Thank you.
Yeah.
Well, my third question will be in terms of the VA clinic of Vieques. I know you are in a process of leasing, finding a new lease, and I know the challenges in Vieques to establish a new one. So let me know, not just me as a member of Congress, but to Dr. Rodriguez and Mr. Montañez, if we can assist in any way with the local authorities to facilitate that kind of transition. In terms of the VA clinic in Arecibo, Arecibo is the major region that attends people coming from Utuado, although we got a clinic there, and from the northern part. I heard some say that you're willing to move that clinic out of Arecibo. If that is the case, I will tell you that I'm going to be opposed because of so many veterans in that area. Know the place. It's more easy to get to there because of differential rural areas on the side. My next question will be in terms of the lack of or shortages of professionals. We talked yesterday about ophthalmologists, oncologists, dermatologists, among other professionals in the healthcare area. I received, like many of the people here, the request that they have been waiting for 3 or 4 months to get an appointment. Most of them, when they visit a VA clinic in the States, that's not the case. They may even receive an appointment in less than 15 to 20 days. So why, if we are in an island and we can't cross state lines by a truck or by a train, just by an airplane, we need to wait 3 and 4 months to get an appointment when you got a VA hospital here, you got multiple clinics, and the people here deserve to have right away the appointment, medical appointment. Why is the reason our people need to wait 3 and 4 months to get an appointment?
And we truly recognize that, but like what Dr. Ramos is saying, that part of the issue that we're encountering in the island is that there are, in specific specialties, a reduction of the available physicians.
Can you list that? Can you list that that professionals that the VA is lacking personnel?
Sure, and I'd just like to make sure that there is a common understanding. So when the VA in San Juan cannot meet that demand, we are actually utilizing choice. But the problem in the community in San Juan is, and you're very aware of this, ma'am, that there are situations in which that is also lacking in the private sector. So we could not, the general problem is how do we attract specific specialties in Puerto Rico? And because that's the one that will be the determinant of how we are going to solve this specific specialty issue.
Do you get the list of physicians, the list of professionals that we're lacking of in the veteran?
Yes, ma'am, we'll provide that to you.
Okay. And I know I'm running out of time, and thank you, the chairman, for his indulgence here. I know that we visited yesterday the trauma center of the Centro Médico, and we don't have a trauma center in the VA hospital in Puerto Rico. Same thing of the lack of services in surgery and mental care, and we even receive complaints in terms of how difficult it is for the blind veterans to just pass across the hospital. Are you looking under those renovations to accommodate the needs of the blind veterans on the island instead of letting them go through the whole hospital to receive services?
Yes, ma'am. We're looking at all of the enhancement that will be required to address the concerns of the impaired veterans.
Please include there the bricks on the entrance in terms of reviewing the needs of maintain those bricks that may have put a lot of strength and difficulties to the blind veterans arriving to the VA clinic. My last question, but I will provide more questions to the committee so they can. Okay, perfect. So my last question during this round then will be the issues regarding the caregivers. A lot of our veterans are receiving care by the caregivers, and those coordinators from the VA must conduct house visits to make sure the veteran is doing well and the caregiver is participating as expected. I know there are two major barriers here. One could be the language barrier, and the other one will be the conducting those visits in the rural areas for the recertification process. In that term, how can we fix the visits in those rural areas? And we got people from the paralyzed veterans, if I recall well, that told us that you're using in the VA system the PO box addresses as their main contact information, and with those PO box addresses, you can visit a veteran in the island. Did the VA, so this is a two-way question, did the VA correct it, those addresses so they can visit the veterans in those areas? And the second one, regarding the barriers to the caregivers' recertification process.
I'll let Dr. Sanchez speak to the specifics of the caregiver program.
Yes. In terms of the mail address, definitely it is a challenge in Puerto Rico because a lot of appointment, not only for caregiver visit, we use the mail. In difference from the mainland, our addresses are HC01 rural, very rural, and they're not standardized like in the mainland. So a lot of letters that we send are returning back, so are very difficult. So what we have been doing, we met 2 months ago with the U.S. Postal Office, and we navigate with them because they have a special software to standardize using the barcodes in the letters, and we are in a project to adopt that. While that happened, what we are requesting to all the veterans is that every time that they do check in our facilities, please update their addresses to assure that is the most updated one that is clear enough in order that we can visit it then and not rely on the P.O. box or the rural one for the boxes. That is a challenge for the organization. We receive a lot of return from the mail because they cannot deliver it. It happened, constantly.
Can you provide a number, a cell phone number, to all those veterans that are suffering from sleep apnea and do not have power in their house, to provide any generators to comply with their care? Like all veterans that receive that kind of service in Florida, and we are missing that to a lot of veterans here that are not receiving those kind of generators because they're living in a zip code number, Puerto Rico.
We can work with that. Generators are issued by prosthetic service, have some eligibility criteria, but at the same time we recognize the need for some special needs for veterans, and we partnered with the Cruz Roja, American Red Cross, and they had a great program that we worked in collaboration with them, and they reach out a lot of veterans providing the generators. So, but it's more to come on that. We need to continue working collaboratively with the resources that the law allow us based upon eligibility, and the community and the American Red Cross as an example with that.
Thank you, Chairman.
Thank you. We talk about provider shortage and the challenges that we face. And it's not just in the VA, it's across the country. In my district, I have an urban area where there's pretty good access to care, but I have a lot of rural areas, and we have a hard time getting physicians to those areas to want to go there and live there and practice there. It is a challenge that we face throughout. And that's a whole nother topic for another day on how we can increase our residency programs, people going into medical schools, expanding our medical schools, et cetera. But I do want to go back to the one thing we talked about. We have many people have gotten their medical education through the military, and they serve in the military. And there are some medical treatment facilities where they now serve that are not very busy. And we have both active component and reserve component. And reserve component are obligated to do a couple weeks a year, weekends a month, and to fill in some time. And that's why I want to take this situation we're in and try and see that we all work together so that we can provide care not only for our veterans but for our civilians, and how we can implement that in many ways and perhaps use our military to fill some of those voids, which will not only serve the people we intend to serve, but give those providers an opportunity to see more patients, to practice their craft, to be better at what they do. It's a training exercise as well. So I look forward to working with all of you in that regard, not only here in Puerto Rico, but across the United States of America, where there are some opportunities because of a situation we find ourselves in. I do also want to go back to what Dr. Rowe asked about. Mr. Ratchford, you're like the all-state mayhem guy. You get to go to all the things where there's a problem, right? Emergencies and building resilience. And there's always lessons learned. So I do look forward to hearing back from you on what we've learned from this and how we can prepare better. And I would like to, you've come this far to be with us today, and maybe just take a minute to discuss what you faced and what you look forward to the future, and as far as the service that you provide.
Thank you, Dr. Winstrup, and also recognizing Dr. Rowe and Congresswoman Gonzalez-Colon. Hurricane Irma and Maria were both challenge events for the state of Puerto Rico and also the Caribbean. One of the things that the Department of Veterans Affairs we did, and I think it really changed the outcome of our hurricane response effort, we recognized the logistical challenges associated with the Caribbean, is that we had to get ahead of that first before we could start talking response and how we were going to help the island nation recover from what was going on. So we worked in close collaboration with FEMA, Health and Human Services, and also the Department of Defense to make sure we were able to move resources to give to our responders on ground, because people are easy. goods and services hard to get here, especially during a crisis. We were fortunate enough, we moved about 128 short tons of equipment to include several response vehicles, 2 mobile medical units, mobile vet centers, mobile pharmacies, logistics support vehicles, and other resources such as generators, AC units, shelters, and trucks to help move things around the island and get response personnel the tools they need to be part of the solution. What we've identified in our after-action reviews that we've done several of them at headquarters, is that logistics is an integral part of your response effort, and you have to think about that up front. Lessons learned we also have noted has been as far as working with the whole of government. We're stronger together than we are by ourselves. We saw a lot of that during response effort at the federal level, to where it took us a brief second to come together and realize we all have things that we're good at, and we all have shortcomings that by design we're not able to do in our organizational makeup. But if we bring ourselves together, we fill each other's gaps, and we work stronger and become a more viable force in responding to these type of disasters. Today, we have our emergency management team from across the nation within the Veterans Health Administration meeting right now in Virginia, talking about not only lesson learned with this type of event, but other type of catastrophic events that we face across the nation, and how as a preparedness community, we could come together, be a part of the solution, and create the environment so that healthcare can be provided without a hiccup, so that restoration of services can happen without a hiccup, so that infrastructure can be restored without a hiccup. We recognize that through emergency management and preparedness, we create that environment so that others can be successful.
Thank you.
Very briefly, I know we have to move on to visit some other things, but all of that is great. But if the people of Puerto Rico don't know, it doesn't do any good. If you don't know where to go when that event happens, and it's all that planning, if we keep it to ourselves, doesn't help all these people sitting out here in the audience at all. I think that we learned today about informing people about what they should do in the event of a hurricane in the neighborhood. In the western part of the island where it's less populated, what do they do? Where do they go? If something happens, where can you get water and food and help and so forth? I think that is something we learned, and I've learned in the things that we've had, the catastrophic events we've had in my district, is that the people have to understand. I want to, Mr. Chairman, thank you, and certainly, Jennifer, thank you for inviting us here. We've learned a lot on our visit. We intend to learn some more before we go back to Washington. We will share these things that we've learned with our colleagues on the Veterans Affairs Committee, which is a bipartisan committee. We try to check Republican and Democrat at the door and do what's right for veterans. So I'd like to, again, thank you for the opportunity to be here. I yield back.
Thank you, Mr. Chairman. And I just got 2 more comments. First of all, I want to recognize Mr. Bernard Johnson, the VA Regional Director for the island. Thank you for being here today. And I got 2 comments and 1 question. One is that we need to fight to get Puerto Rico out of the overseas definition in terms of Triker Prime. I mean, our veterans need to be treated as all American citizens, not because their zip code is different. And right now, Triker Prime do not apply to the island just because under the Department of Defense, we are considered as an overseas territory. So that's our first request. I've been writing some letters to the Department of Defense. It's been contabilized at $29.7 million, just including the coverage of Puerto Rico as part of the Triker Prime. So that's one of the challenges that I will love the committee to coordinate with me to try to achieve that kind of equality for the veterans in the island. The second will be, we got a facility, state veteran homes in Juana Diaz, and it is 20 years old. It's deteriorating. The state matching requirement has been a challenge for providing maintenance for all those projects. So we need to see how the VA can help us out and make any adjustment that we can make to account for houses located in rural areas or impacted by natural disasters. On the other hand, I think we should look forward to enforce any cooperative agreement with pharmacies and other federal agencies. So no veteran and no service to our veterans is turned down during a hurricane or any other any other period, and that's happening in a more frequent way in Puerto Rico. Our pharmacies and doctors are turning down our veterans, and that's something we need to work together to achieve a better understanding and a better way to serve our men and women in uniform. Having said that, I'm looking forward to have the transfer of the land for the Fisher House. So we can finally get that, not just for the people of Puerto Rico, but for the people that are coming from the Virgin Islands to receive those kind of services. I want to thank all the personnel from the VA that help us out during this hurricane season. I know that most of you rode out the hurricane in those facilities. I know how hard is that because I did that in my own house. But one of the main issues that remains there, it's how our facilities are gonna comply with the new standards and how our people are gonna receive the service that they need. I hope the allocation of funds that were included in the third supplemental are gonna be enough for all the VA clinics and the National Cemetery. If not, feel free to tell me what resources do you need to make those things happen to our veterans in the island. With that, I want to thank all the members, all people who serve and fought for our nation. We are grateful for your service and for the people that are here today. And thank you, Chairman Wenstrup and Chairman Rowe, for allowing me, as the only member representing 3.4 million American citizens in Puerto Rico, to have a voice on behalf of our veterans, even when I can't vote on the floor. Thank you, and welcome to Puerto Rico.
I want to once again thank all of our witnesses today for your insights, and to all those here in the audience for taking the time to be with us this morning, and thank you for the hospitality and the warm reception that we have had here. It's been a pleasure being in Puerto Rico with you, and I look forward to taking your comments and your suggestions and your ideas back with me to DC. This time I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include extraneous material. Without objection, so ordered. The hearing is now adjourned.